As we celebrate National Hispanic Heritage Month, we turn our attention to issues affecting Latino students who are learning remotely during the pandemic. Joining us now to talk about that is Francine Rojas. She's a social worker and she's employed with Butterfly Counseling Services in Queens. Ms. Rojas, thanks for being here.
Thank you so much for having me. It's a pleasure to be here.
Well, we thank you for your time. So you've worked with children in schools. Talk to us about the challenges that Latino students face, especially now during the pandemic.
During this pandemic, many students have been experiencing a lot of sleepless nights. I think sleep habits have been huge for many young people. In addition, many young people are experiencing anxiety around being in school, going out to public places, and socializing. I think there's also been a lot of depression. So it's been a gamut of emotions.
Well, COVID-19, as you well know, has devastated the Hispanic community. Many children have suffered tremendous loss. Is there enough support to help children deal with their trauma so it doesn't impact their academic performance?
I think there's been a huge silver lining during this pandemic. What I find great is that a lot of students have been able to access mental health services through virtual platforms because many clinicians have transitioned to those platforms. And with the accessibility of technology, many people have been able to connect with Spanish-speaking and culturally competent therapists.
So talk to me. I want you to expand a little on that silver lining. We know young people are resilient, but sometimes if there's a language barrier, all of this can be confusing. So how do you cut through all of that to teach Latino and Hispanic students to stay strong?
You know, I think the biggest obstacle sometimes is the stigma attached to accessing mental health services. Yeah. There's always the thought that if you access services that you're not strong or that you put yourself in a vulnerable place. And because this pandemic has been impacted everyone in the community, I think young people are realizing that it's good to access these services. And because faith-based organizations have equally been normalizing this experience and encouraging even parishioners to seek out mental health services the same way they would seek out medical services, it's something that I think has really been a huge silver lining for accessing services in general.
You know, one last question for you, Ms. Rojas. I'm so glad we're talking because in Queens, where your counseling services are located, hotspots with COVID have erupted, and many children and their parents are finding that they're back to restricting their movements, fewer mass gatherings, and schools in some parts of Queens and Brooklyn, of course, are closed. Talk to me how that's affecting the emotional, how it's affecting the emotions of especially Latino and Hispanic students.
You know, I think when the pandemic started, there was an increase in anxiety. And as the pandemic continued, people started to realize that, okay, we can have little its and bits of our life. But with these spike in numbers, people's anxiety have increased. And I think what's different than when the pandemic initially started is that people are recognizing that they can reach out for services like Butterfly Counseling Services located in Queens and others. You know, you can call NYC Well and access services through that agency where you can connect with therapists in your network, in your insurance network. But I do believe that the spike has impacted people's anxiety. People are starting to get scared of going out again and being connected with people.
Okay, Francine Rojas with Butterfly Counseling Services in Queens. Thanks for your time this evening. We really appreciate it.
Thank you so much for having me.
Absolutely. There's still much more to come on Live at 10 on this Friday.